Collaborative, we know that women and immigrants of color have been particularly impacted by the pandemic. We recently conducted a national poll of women of color voters, which found that more than 7 in 10 women of color have been directly impacted by COVID-19. Notably, almost 8 in 10 Latinas and Latinx community members reported being personally impacted by the pandemic. 1 in 4 had a family member die. And they were also more likely to personally become sick with COVID-19 or have a member of their household get sick. Additionally, 1 in 3 Black women and AAPI women noted their mental health had suffered during the pandemic. And that 2 in 5 AAPI women say they have been personally impacted by instances of racism and violence as a result of COVID-19. So while the priorities of women of color are not monolithic by any means, we learned from this polling that women of color want to see members of Congress make progress on issues such as ending discrimination because of race, ethnicity, immigration, or culture, and ensuring that people can access health insurance. And importantly, we learned that women of color are watching their elected officials to make sure they are following through on promises, prioritizing their needs, and that members are taking an intersectional approach to their policy work. The barriers that led to this disparate impact for immigrants and women of color existed long before the pandemic and will continue to persist if we don't find proactive and long-lasting solutions to ensure that all individuals have access to healthcare coverage, regardless of immigration status. You know, as a proud immigrant myself, who moved to the United States with my family when I was 3 to find healthcare for my brother, I know firsthand what it means to fight for vital healthcare access. And we know that our communities need bold legislation like the Heal for Immigrant Families Act and the Lift the Bar Act so that immigrant communities can access affordable healthcare for themselves and their families. And that's how we move forward to a more equitable healthcare system, both in and out of this pandemic. Thank you for joining us again today. Back to Yvonne.
Thank you so much, Lupe. Next up, we have Adriana Kadena, Executive Director of Protecting Immigrant Families Coalition.
Good morning. Thank you so much for this opportunity to be with everyone. I think, well, as mentioned, my name is Adriana Kadena. I'm with the Protecting Immigrant Families Coalition. For us, it's extremely important that we are able to restore access to benefits, and in particular because there are certain benefits that had already been provided to immigrant communities that the Lift the Bar and Heal would return and restore. PIF is a network of over 540 organizations in 48 states, spanning across the sectors of healthcare, nutrition, economic security, child and family advocacy, immigrant rights, faith, and social justice. And our goal as this broad coalition is to ensure that 1, we educate our communities about the services and programs that are already available. And 2 is that we advance and restore access to public supports programs that can have a tremendous impact on the lives of children, women, and adults in the United States. Over the past 4 years, PIF has worked along with all of you to defeat the 2018 Trump administration proposal on public charge. And working together with all of you made a tremendous impact, and we should be very proud of the progress that we have made. And we also want to thank you and your bosses for supporting the recent Biden administration in PRM on public charge. However, I think as Lupe very well stated, now is the time to build a better future and create opportunities for immigrants in the United States so that they have access to services that are extremely needed. I will tell you that as an immigrant child growing up in Texas, being able to access services was far away from our reality, as we were struggling as a family, undocumented, in trying to identify what was available. And so when the 1996 welfare reform came about and there was a 5-year bar implemented to keep lawful permanent residents from accessing essential services, was just another devastating attack to our communities. Just like the Trump public charge policy, the 5-year bar contributes tremendously to racial disparities in health and economic security, and it denies safety net programs to entire families. And what's important to understand when we talk about immigrant families, we are talking about mixed status families, families that have US citizen spouses, that have US citizen children who are feeling the effects of these erroneous attacks on our community. So for us, the Lift the Bar and the HEAL Act are very important because one, they would repeal the 5-year bar and other services to people who really need critical access. It would restore access to programs like Medicaid, CHIP, SNAP, simply by removing the 5-year bar. And who are we talking about? What people are we talking about? We're talking about people who have green cards, who are documented, who are crime victims, who are children with special immigrant juvenile status, and other immigrants who are already part of our communities and who are residing lawfully in the US. And Lift the Bar and the HEAL would also help people like my friend, Leslie. She is a permanent resident who has breast cancer and is struggling to pay for her treatment. So when we ask you to be able to work with us and advance these really important policies, is because we are living this day in and day out. And there are specific provisions that the Lift Bar would particularly repeal when it comes to the 1996 Welfare Reform Act. One, it would restore, it would, the welfare reform restricted access to lawfully present immigrants to be eligible for federal assistance programs. It allows states to adopt more punitive restrictions. And if you live in a state like Texas, where I live, then you know what that really means when we are on the ground trying to increase those access. The welfare reform also erected barriers for states and localities who actually wanted to be able to use their own funds and establish more inclusive programs. So what the Lift the Bar would do, it would redefine, it would take away the 5-year bar. It would redefine who is a qualified citizen so that more people are able to access services. And it would provide, it would begin to dismantle this disparity that we see in healthcare access. And I just want to end by saying that, Lift the Bar is not necessarily far from the hearts of many Americans. A recent poll showed that 3/4 of Americans support this act. And therefore, it is important for us to continue working and to make this a viable option for our communities. 25 years is punishment enough that immigrants communities have endured. And it is punishment enough for people and my friend, Leslie. So it is time to right the wrong. And I thank you for the opportunity to be here and really looking forward to advance the Lift the Bar and the HEAL Act. Thank you.
Thank you so much, Adriana. Next up, we have Elizabeth Bosch, with the Director of Income and Work Supports at the Center for Law and Social Policy. Elizabeth?
Hi, thank you so much for having me. I've been asked to talk a little about how we got to where we are, what the policies are, and what the impact has been in the data. So to start with, you heard about quote unquote welfare reform. This is the Personal Responsibility and Work Opportunity Reconciliation Act of 1996, sometimes awfully called PRORA. This law was built on deeply racist and classist assumptions, including that people, especially people of color, won't work unless they are forced to, that people have babies in order to get welfare, and that people come to the US to get welfare. And in response to the assumptions, it had some deeply harmful policies. Next slide, please. So it created, whoops, we missed the slide, sorry, I think. No, so yeah, it created a new category of qualified immigrants, which had not existed before. And this is not an immigration category, it's a public benefits category. And it made non-qualified immigrants are generally ineligible for public benefits, with some exceptions such as emergency Medicaid and disaster aid. States can serve them, but only if they explicitly pass a law, as we've seen in recent years. And one thing to flag is that non-qualified immigrants is a broader category than undocumented. People sometimes conflate the two, but asylum seekers, tourists, and now DACA recipients are non-qualified immigrants. So that's a broad category. But then for qualified immigrants, it imposed restrictions as well. Some very stringent restrictions on SNAP and SSI, and then the 5-year bar. If people obtain status after the date of enactment of PRORA, they were barred from federal means-tested public benefits, which has been defined to include TANF, SSI, SNAP, Medicaid, and CHIP for 5 years. One thing to note is that there are exceptions, particularly refugees, asylees, others exempt on humanitarian grounds. Some other categories are exempt from the 5-year bar. Next slide, please. Okay, I see. I covered this material already. It got flipped around a little. Can we get to the next slide, please? So as soon as this was passed, there were deep drops in immigrant access to benefits. You'll see participation in means-tested benefits for legal permanent resident alien families dropped quite dramatically across the programs in the years following enactment of the 1996 law. On August 22nd, 1997, the 1-year anniversary, approximately 900,000 people lost eligibility for SNAP overnight. One thing also to flag is that even people who were not supposed to be affected by this, who were exempted, were impacted. There was about a 58% drop in the use of Medicaid by refugee adults. Again, refugees were exempted from the restriction, but there was still this huge chilling effect of the restrictions. Next slide, please. Congress almost immediately started recognizing that it had made some bad choices and starting to restore at least some of the cuts. In particular, SNAP was restored to people who had arrived before the 1996 law, children and people with disabilities, and then to qualified immigrant children and adults after the 5-year bar. Moving forward, CHIPRA gave states the option to provide Medicaid and CHIP to lawfully residing children or pregnant persons. Note that that lawfully residing term is not the same as qualified immigrant. So again, this adds to the complexity even as it improves access. Next slide, please. Not going to get into all the details of this because I know we're short on time, but just Congress kept on sort of carving out small exceptions, slight adjustments. One thing to note is that ACA, when it was enacted, lawfully present immigrants were made eligible for marketplace subsidies, although not for Medicaid. Again, DACA was created, but DACA holders are not considered for this purpose lawfully present. Next slide, please. The result of this has been a patchwork of coverage. This one shows immigrant children, and you can see some states have adopted that CHIPRA option to cover immigrant children. Some states are using their own funds to cover at least some lawfully, some children regardless of immigration status. That's the dark green. But a lot depends on what state you live in. Some states have no coverage for immigrant children. Next slide. The other thing is that even in a specific state, it's created just an incredibly complicated process for figuring out who is eligible for what. This is, quote, a quick guide to immigrant eligibility in Virginia, and it's only for the health programs. And you see it is full of details and exceptions. And if you add the food programs, if you add other states, it just adds to the complexity, which makes it hard for people to know what they're eligible, as well as for states to administer. Next slide, please. The result is undocumented folks are less likely to have insurance coverage than lawfully present immigrants, who are still far less likely to have coverage than citizens. And for children, citizens with at least one non-citizen parent are far more likely to be uninsured than citizen children whose parents are also citizens. Next slide, please. It also had a great impact on food insecurity, including during the recent COVID crisis. This is an Urban Institute survey, September 2020, significantly more likely to experience food insecurity in families in which any member is a non-citizen than in where all family members are citizens. We know that public charge was part of these concerns, but not the entire story. Next slide. So the proposals, and we've got heal and lift the bar. This says Senate bill pending, and my understanding is Senator Hirono is now circulating a sign-on letter for this, a dear colleague letter. So please, if you're on the Senate side, please get your bosses to sign on to that. HEAL for immigrant families focuses on the health programs. It would lift the 5-year bar for Medicaid and CHIP. It would allow DACA recipients to access Medicaid, CHIP, and the ACA, and allow undocumented immigrants to access ACA marketplace plans. Lift the bar focuses more on the 5-year bar. It looks at the full range of programs. It would eliminate it for SNAP and TANF, as well as for Medicaid and CHIP. And it would amend the qualified immigrant language to align with lawfully present, which would include groups that are not eligible now, including DACA and special juvenile immigrant status people. I know I went really fast through this because we're short on time. If anyone wants to wonk out on the details, please do follow up with me offline, and I'm happy to discuss.
Thank you so much, Elizabeth, for that really great presentation and overview, and for making sure that we have time for impacted individuals to present. Just as a reminder, for those of you who have questions for any of our speakers, please drop them in the chat. We will have an opportunity at the end of the presentations to answer them directly. So next in the program, we will have directly impacted individuals share their personal stories of how the healthcare system has not worked for them. First, we will have Nilofar Zaman, who will be speaking in Bangla. Interpretation will be provided by NAPAV Georgia member Snigdha Hoke, whom we all call Snigdha Auntie at NAPAV. Snigdha and Nilofar are part of NAPAV's Georgia chapter, where we base, build, and organize. Nilofar is having some technical difficulties today, so she will be joining by phone, I think through Snigdha Auntie's line. So please bear with us as we grapple with the technical challenges. Snigdha Auntie, Nilofar, I'm turning it over to you.
Yeah, so Nilofar, you can start.
Hello everyone, I am Nilofar Zaman. আমি আমার গল্পটা আজকে বলতে চাই। আমি ইমিগ্রেন্ট হয়ে আমেরিকাতে আসি 2010-এ। আসার পরে আমার জীবনটা এত সহজ ছিল না। আমার 2011 শেষের দিকে আমি প্রেগনেন্ট হই এবং আমার কোনো স্বাস্থ্য সেবা ছিল না। তো আমাকে এটা কিনতে হয় প্রেগন্যান্সি থেকে ডেলিভারি পর্যন্ত। 2012 জুন 15-তে আমার ছেলে হয়। তার আগে ঠিক 7 দিন আগে আমার বাবা অসুস্থ হয়ে যান এবং আমার বাবাও ছিলেন ইমিগ্রেন্ট, কিন্তু আমার বাবারও কোনো স্বাস্থ্যসেবা ছিল না। এই কারণে সে আমাদেরকে এতটা গুরুত্ব দিয়ে বলে নাই যে আমরা হয়তো বা এটা নিয়ে খুব চিন্তিত হয়ে যাব বা কোথায় নিয়ে যাব। এর মধ্যেই তার একদিন হঠাৎ করে রাত্রে শ্বাসকষ্ট হয় এবং আমরা 911-এ ফোন করি। ওনারা আসেন, চেক করে বলে যে নিউমোনিয়া এবং সাথে সাথে নিয়ে যায় হসপিটালে। একই হসপিটালে আমিও আমার বাচ্চা হয়, ভর্তি হওয়ার পরে বাচ্চা হয় এবং আমার বাচ্চাকে নিয়ে আমি যখন বাসায় ফিরে আসি তখনও আমার বাবা হসপিটালে। তো অপেক্ষায় থাকি কখন ফিরবে, কিন্তু 12 দিন পরে আমার বাবাকে আমরা হারাই। তো আমার এটা বলার উদ্দেশ্য এটাই যে আমরা যারা ইমিগ্রেন্ট হয়ে আসি তাদের যদি প্রথম থেকেই স্বাস্থ্য সেবাটা সহজ থাকে, সহজ করে দেওয়া হয়, তাহলে হয়তোবা প্রথম অবস্থায় আমার বাবাকে চিকিৎসা করলে হয়তোবা এতটা খারাপ পর্যায়ে যেত না, আমাদের মাঝে হয়তো এখনো থাকতো। তো আমার আনন্দটা আর আমার কষ্টটা আসলে এখনো আমাকে কষ্ট দেয়, আমি কোনটাকে নিব বুঝতে পারি না। থ্যাংক ইউ সবাইকে, ধন্যবাদ আপনাদের সবাইকে।
Okay, so hello everyone, I'm Snigdha, everybody call me Snigdha auntie. So Nilufar just share her story because she feel like every immigrant should have the healthcare access, because she said like her story is she came here on 2010, and when she came here, as first that was not, everything was not going right, but one by one they are setting their life. And on 2011, end of the 2011, she got pregnant, and like that time she have to buy that time she doesn't have any Medicaid, so she have to buy for her pregnancy, whole pregnancy and whole until delivery, she have to buy the package. And on 2012, on June 15, her son born. So before, like 7 days before, her father was sick, but her father was immigrant, but he didn't have any Medicaid. So as a parent, you know, we always thought like anytime we will do anything and my kids, they have to spend their money from their pocket. So he was not different from them. So he thought like maybe he will be cured very soon, but he didn't. So before like 2015, he felt really sick one day, like he cannot take breath. So that's time Nilufar families, they called 911. They came and they checked like he had pneumonia. So they just recommend like you have to get her to the hospital as soon as possible. So they took him to the hospital, and Nilufar said like that's really hard part for her, because she was in 3rd floor with her baby boy. She was excited because that's her first time she was mom. But the 2nd floor, her dad was suffering, putting, you know, like he cannot take breath, and he is fighting for the fighting with the death for life, you know. So she said like if he have a like even he doesn't have any Medicaid, so if he have Medicaid and if he cannot think about her case, like okay, if I tell them like I'm not feeling sick, so he always thinking about like my kids are spending their money from pocket. So that's why he didn't tell anything. So that's why like his condition getting worse. So yeah, Nilufar said like every immigrant should have the healthcare access, so like nobody can lost their loved one like how Nilufar gets. So Nilufar said like she is really still feel like anytime he feel about and think about that time, you know, because she said like she have to buy her happiness for her first kids, and she have to buy also like her dad, so anything like if your own experience, like anything you want as an immigrant without healthcare access, so that's really hard for us, like who came here as an immigrant. So that's why Niloufar asked, like, if the HEAL Act will be, the healthcare access will be accessible for all immigrant, all newcomer, that should be really helpful for us, and nobody can lose their loved one like how Niloufar lose her dad. So thank you so much. That's Niloufar said.
Thank you so much, Niloufar, for sharing your story. And I'm so sorry you had to go through that. And thank you so much, Nigda Andi. Up next, we have Diana Pliego, a policy associate with the National Immigration Law Center. Diana.
Hi, everyone, and thank you for being here. My name is Diana Pliego. I'm a DACA recipient and part of a mixed status family. I'm also a policy associate at the National Immigration Law Center. So I am both an immigrant and an advocate, sharing my story with you today. As I mentioned, my family is one of mixed status. One brother is a US citizen and two brothers are DACA recipients as well. My dad was fortunately able to finally become a legal permanent resident a few years ago, but he has not yet completed the 5-year waiting period that has been mentioned on this briefing. My mom, unfortunately, remains undocumented. I grew up low income, often barely able to make ends meet. So I know firsthand what it means to grow up without access to proper healthcare. My family never went to the doctor unless it was an absolute emergency, absolutely necessary, because we simply could not afford it and it just didn't cross our minds as an option. And this pandemic, unfortunately, has reaped the seeds of a lifetime of medical neglect. This past fall, I lost my older brother to COVID-19, and I came scarily close to also losing my dad. At one point in time, my entire family was in the hospital, all because they waited far too late to even consider going to a doctor for treatment. I'll be the first to admit that the loss that my family has experienced is layered and nuanced. The complications that led to my family's long and painful hospital stay and ultimately led to my brother's death are complicated. However, I can't help but wonder, had my family had proper access to healthcare and preventative treatment for the health issues that led to their COVID-19 complications, would my brother still be here? Could my dad and my family have been spared from the trauma that we've endured? My brother had DACA and my dad was a legal permanent resident. Both were contributing members of their communities, well known and loved. They were small business owners. They had a painting company. Yet they wouldn't go to the doctor after contracting COVID until my dad nearly passed out from the lack of oxygen and my brother could barely breathe. My dad's oxygen levels were below 30. The doctors, the EMTs, they didn't really know how he was still alive at that point. They were literally dying, but afraid of getting help due to the cost of medical bills. We had to convince my mom and call an ambulance for her because she was afraid to go to the hospital just because she was afraid because she was undocumented. As an immigrant and an advocate, I know that I'm not the only person in this country facing these similar circumstances, asking themselves the same what if questions. And the thing is that I don't believe that anyone should be in this position. Had the HEAL Act and the Lift the Bar Act been in place before, were these arbitrary and racially motivated bars and waiting periods not be in place, if my family didn't have to drive an hour to get medical care at a free clinic that looks past their status, if the local community clinics in their town had the proper resources and staffing to address the needs of the community, things might be different. And no one deserves to live with those what ifs. Our communities, like everybody else, deserve equal and affordable access to healthcare, and not just when their illness reaches a critical point, but long before when things could be prevented. So as someone who's lived with the very real effects of what happens when people don't have access to healthcare because of these arbitrary and racially motivated laws, I urge your bosses to all consider co-sponsoring these two bills. It is far more than just a message to folks that they are welcome in this community, in this country, and that they deserve access, but it has real life impacts that could save lives. So I really do urge you to take these stories that folks are sharing here with you today, bring them to your bosses and have them join us and move these bills forward so that they can become law and more people can have access to life-saving medical care. Thank you.
Thank you, Diana, for sharing your story and everything your family went through during the pandemic. It's not uncommon. I think we've also heard, immigrants not getting tested because they don't know how much it will cost and they can't pay out of pocket. So these are stories that are unfortunately very common for our communities. So last but not least, we have Miriam Gomez, an activist with the Latina Institute of Texas. Her translation today will be provided by Maria Angelica. Miriam.
Hola, buenas tardes. Quisiera compartir con ustedes cómo es que la ley de 5 años ha afectado mi vida, negándome el acceso a un servicio de salud digno. Yo llegué a este país hace 7 años embarazada de gemelos y teniendo un niño de 4 añitos, huyendo de violencia del entonces mi pareja. Al llegar a este país, solo me he dedicado a trabajar duro para sacar adelante a mis hijos y ofrecerles un mejor futuro. Y por fin, a principios de este año, pude obtener mi permiso de trabajo y pronto mi tarjeta de residencia. Desafortunadamente, a principios de año me diagnosticaron con la enfermedad de diabetes, que se me desarrolló por efectos secundarios del COVID-19. Desde entonces realmente ha sido muy difícil porque mi salud ha decaído. Al no poder contar con un servicio de salud, he tenido que encargar a México mis medicamentos, mis tratamientos, que hay veces que me he quedado sin ellos, porque no siempre me llegan a tiempo, no siempre me los pueden traer. Y eso es muy desafortunado, porque a pesar de poder arreglar mi estatus legal en ese país, tenga que esperar 5 años para poder contar con un servicio de salud, que realmente debería de ser un derecho. Sin contar que gracias a esta enfermedad a veces no puedo trabajar como debe de ser, no rindo como antes y eso me asusta porque yo tengo unos pequeños que dependen de mí y me da miedo que al no tener un tratamiento adecuado ya no pueda ni siquiera cuidar de ellos, sin contar mantenerlos, alimentarlos y demás. Eso ha sido muy duro de llevar. Por eso hoy estoy aquí para que conozcan mi historia de lucha diaria y ojalá sea de ayuda para, así como yo, hay más mujeres y hombres que necesitan un servicio de salud que no debería de ser negado, que tienen enfermedades crónicas como la mía y que no contamos ni con los servicios ni con el dinero para tener un acceso a la salud. Muchas gracias por escucharme. Esta es mi historia.
This is Miriam Gomez's statement. Hello, good afternoon, good morning. I would like to share with you how this 5-year law has affected my life by denying me access to decent healthcare. I arrived in this country 7 years ago. I was pregnant with twins with a 4-year-old child. I was fleeing violence from my then partner. And upon arriving in this country, I have only dedicated myself to work hard, to raise my children, and to offer them a better future. Finally, earlier this year, I was able to get a work permit and soon my green card. Unfortunately, at the beginning of the year, I was diagnosed with diabetes that developed due to side effects that I had when I got sick with COVID-19. Since then, It has been difficult because my health has declined. Not being able to count on health services, I've been having to order my medications from Mexico. And there are times that I have been left without medication because they don't always arrive on time or they can't bring them to me. And it is very unfortunate that in spite of being able to fix my legal status here, I have to wait 5 years to be able to have healthcare, which should be a right. Not to mention that because of this disease, sometimes I can't work as it should be. I'm not able to perform like I used to. And that is scary because I have little ones who depend on me. And I am afraid that because I don't have proper treatment, I'm not going to be able to take care of them. Not to mention keeping them fed and so on. And that has been so hard to bear. So today, that's why I'm here, so that you may know my story, which is a daily struggle. And I hope it is helpful for you to listen to it. I know that just like me, there are many men and many women who also need healthcare, and it is denied. And they also have chronic illnesses like mine, but we don't have the service and we don't have the money to be able to access this healthcare. Thank you for listening to me. This is my story.
Thank you so much, Miriam, for sharing your story. Next, for the final portion of our program, before we go into Q&A, and again, if you have questions, feel free to drop them in the chat. We'll also have an opportunity for folks to unmute and speak. Next in our program, we will hear directly from a provider, Julia Liu, the Chief Executive Officer of Asian Health Services. Julia.
Thank you, Yvonne. Good morning, and thank you for having me here this morning. Asian Health Services, we are a nonprofit clinic that has been around for nearly 5 decades. We have 500 staff focused on providing healthcare for our most vulnerable in the community, from doctors to dentists to mental health providers. We serve 50,000 patients in 14 languages, of which 12 are Asian languages. We serve these patients who otherwise would not have access to healthcare because they don't speak the language, they can't afford healthcare, or because of their immigration status. As a community health center that never closed its doors since day one of the pandemic, Asian Health Services saw firsthand how COVID and anti-Asian hate greatly exacerbated the health disparities of our patients and communities. We saw that mental health visits rose close to 50% more. 75% of our patients feared leaving their home, and thousands were in need of urgent financial support. But because California has extended Medi-Cal, SNAP, SSI, and CalWORK's eligibility to legal immigrants, making them eligible for these programs, regardless of their date of entry, thousands of our patients, parents, caregivers, essential workers, our elders, were able to access critical medical, dental, and behavioral healthcare services and resources during the pandemic. I'd like to share 2 stories of our patients whose names I've changed for confidentiality. I'd like to start off with the story of Ms. Nguyen, a recent immigrant from Vietnam who had been residing in the US for 2 years. Ms. Nguyen works at a local restaurant in California. Her 4-year-old son had recently passed away due to health complications during a dental procedure by another non-AHS dental provider. This unthinkable tragedy caused her husband and her great grief, which impacted her mental health and her overall health and well-being. When the pandemic hit, she and her husband could not work and they faced economic challenges. They couldn't even buy groceries for themselves and their remaining son. She did not know where to turn next. She had heard about the 5-year bar restriction and thought she was not eligible to apply for public assistance benefits. Fortunately, she was connected to our clinic and our staff immediately enrolled her and her family into our care. Our staff let her know that because she lives in California, she qualifies for Medicaid and other programs, including SNAP, and our mental health counseling and services, regardless of the number of years she resided in the US. We immediately enrolled her into CalFresh, provided her with mental health counseling and community resource navigation. With counseling and nutrition support, she is able to continue to work and live a healthy and productive life. Another patient of ours, Ms. Pham, also a newcomer who had resided in the US less than 5 years, had a son with severe epilepsy. As a new American in California, she found it extremely difficult to navigate the health system and obtain services for her son. Given her son's severe disability, Ms. Pham was unable to work. Fortunately, our staff were able to enroll both her and her son into Medicaid, and her son was able to receive the specialized health care that he needed. Because California did not have the 5-year bar restriction, Ms. Pham was able to enroll into Medicaid as well as TANF so that she could access cash aid and services that could support her economic and financial needs. As a result, she is able to continue to care for her son, and her son has been able to receive critical health services and care that he needs. As illustrated with these two stories, lifting the 5-year bar in California has been absolutely critical in helping to eliminate major barriers for legal immigrants like Ms. Nguyen and Ms. Pham to accessing healthcare services. Both were able to access life-saving measures for themselves and their families during times of financial challenge and extreme tragedy. While the current administration has taken a major step forward in ending the harmful public charge policy, it is just as critical to end the 5-year bar to creating consistency across states and to help address the confusion families often face in understanding whether or not they qualify for critical services and resources. In doing so, Congress will help millions of immigrants like Ms. Pham and Ms. Nguyen and their families who are lawfully present obtain the quality healthcare, nutritious food, safe homes, and economic security that every family deserves and needs to thrive. Thank you.
Thank you so much, Julia. Thank you so much to all of our speakers. We're going to take this time now to open it up to questions from the audience. If you would like to ask a question, please use the hand raise function and introduce yourself by sharing your name and office. You can also, again, drop questions in the chat. While folks get started, I just wanted to make a note to those in to the Senate offices that Senator Hoerner will introduce the Senate version of Lift the Bar in the coming days. Again, note that the deadline to co-sponsor as an original is close of business this coming Tuesday, May 17th. Interested offices should reach out to Wendy Clarence in her office, and I think someone can drop Wendy's email in the chat. So I'm going to go ahead and get us started with some questions. So first, I think it seems like these policies there are a lot of really great reasons, as we heard from all of our speakers today, to get Heal and Lift the Bar enacted. But given our political climate, I was wondering if someone would be able to answer what the likelihood of getting momentum and movement and traction on these bills are. Juan or Ben, Juan from class, or Ben from the National Immigration Law Center, maybe one of you could speak to this question.
Yes, absolutely. I'm happy to jump in. Well, I think, and it was noted earlier, just to state how popular this policy is, just restate that. A recent poll by the Protecting Immigrant Families Coalition found that 74% of Americans support legislation to reverse policies that restrict safety net access for immigrants who are lawfully present in the US and their families. So our constituents really need this policy, and we have to continue to support it and build support for it. Right now, this bill has over 90 co-sponsors and growing. And I think the most important thing that we can do is continue to advocate for it and push for it until we get this passed, whatever means possible. And whether that's passing these bills or getting included in a larger package, I think there's a real possibility to do that, and a lot of reasons why we need to, as spoken from everybody who's talked so far.
Thanks, Juan. Ben, was there anything you'd like to add to that?
No, so this has been with National Immigration Law Center, and Juan and I have been working a lot on this bill. I'll just say that in addition to everything he said, we're just continuing to monitor, and we want to make sure that if opportunities arise, we can have a very robust opportunity to show support for this and move it forward. We all know, right? Legislation doesn't move until it moves. And I also know that our great partner in Senator Hoerner's office, Wendy, just put her email in the chat. And so co-sponsoring is the best way to show that there's support to move when it can move.
Thank you. And I see Wendy is also here. I have a question here for Wendy. Wendy, can you tell us a little bit more about timing on the bill? And thank you so much for all of your work on Lift the Bar, and a huge shout out to the Senator.
Hi, thanks. Hopefully people can hear me. I'm on my cell phone
Yes.
today. Okay, great. So for timing on introduction, we are really hoping to introduce next week, Wednesday. So we set the deadline for co-sponsors for close of business on Tuesday. Feel free, I put, like Ben said, I put my email in the chat. So feel free to connect with me if you have any questions, or if you think your boss is interested in co-sponsoring. This is also, May is Asian Pacific American Heritage Month. So we thought it was a good timing to highlight some of the health disparities that have been mentioned during this briefing. This bill would really go a long way to help eliminate those disparities and break down the barriers. So again, feel free to reach out to me on the Senate side and with any questions or anything at all. Thank you.
Thank you, Wendy, and thank you again for all of your work on this. So I think what we can also, let's see if there's a next question here. So I have a question on how this bill relates to current, sorry, trying to read the various things that are coming in. So given concerns that expanding access to benefits may encourage more people to come, should we allow people to stay in the US if they drain? I think there are criticisms that this drains our system and drains our country's resources. Is this something, Elizabeth, is this something that you can help speak to?
Sure. So first, just acknowledging that, as I said, these are the concerns that led in 1996 to the enactment of the 5-year bar and the other restrictions. And I'd say, first, that's a story, but it's not very connected to the reality. People come to the US because they have family here, because they're seeking economic opportunity, because of domestic violence, because of war. There are a lot of things that drive people to immigrate, and applying for public benefits is really not the driving force. But also, I want to push back on the notion that receiving Medicaid or SNAP makes you a drain on the system. In fact, we know that receiving healthcare and nutrition lets people thrive and makes it more possible for them to contribute to society and be family members, workers, all the different ways that we know that immigrants contribute to our society. And we've really just, built a society where a lot of jobs, don't provide health insurance or don't pay enough for people to fully meet their needs. So this is really not about individual choices, but about the society that we've built. And we're all stronger when everyone has access to basic needs.
Thank you, Elizabeth. So I think with that, I really want to just thank all of our speakers today, especially those who shared their personal stories, and a huge shout out to the staff and partners who helped put this briefing together. Special thank you to Lucy Arvayo with the Latina Institute for all of her work in pulling this together. As you all continue and go back to your work in offices, I really just ask that you continue to center the folks that you heard from today as conversations on access to healthcare and reproductive care continue to be on the line. And really appreciate, again, thank you to everyone who joined today. Please reach out to us if you need any information, any talking points, additional information on the bills, or how you can plug in and support. Thank you again, and it was my pleasure to moderate this conversation today. Have a wonderful rest of your day. Thank you.